So, topography of the esophagus. First question, parts of the esophagus. This is picture from textbook of Sapin. We shall use it in our tests, and all designation you should know, you should recognize each detail, each number in this picture, and to make it more easy, let us together try to draw it. So, in left part of our screen, I begin to draw this picture from above. So, this is designation of lips, for we can compare the different parts of esophagus in length. So, first part is pars cervicalis. Pars cervicalis is situated at the level of 6th cervical to 2nd thoracic vertebrae. We know that pharynx, laryngeal part of the pharynx, is finishing at the level of 6th cervical vertebrae. That means that since 6th cervical vertebrae to the 3rd thoracic, this part is cervical part of the esophagus. It's quite short, and practically we can say that this part we can find only in the most lowest part of the neck. Next part is pars thoracica, which is situated in the posterior mediastinum. Posterior mediastinum is part of thoracic cavity which is located between two lungs, and posterior mediastinum means that this organ is located more dorsally than another organ. Practically it lies on the corpus vertebrae of thoracic part of the spine. Then next or third part of esophagus is pars abdominalis. Again, quite short part of the organ, which is situated in the abdominal cavity. So, if we try compare these three parts, it means that most short parts are cervical and abdominal parts, and most large, most long part is thoracic part of the esophagus. The common length of the esophagus can reach 25 or more centimeters in quite high persons, but the middle length is about 20-25 centimeters. Next question is topography of the esophagus, exactly syntopy and skeletotopy. What is syntopy? or in Latin syntopia, skeletotopia. Syntopia means the relations with another organs which are close to the esophagus. Skeletotopia means projection of the organ to parts of skeleton. Usually we use the vertebrae and ribs to understand skeletotopy. And we know also the term holotopia, golotopia. It means projections of the organ to the surface of the body. So if we speak about syntopy, we can say that first of all we need to look at syntopy in different level according to the parts of the spine. So this is the borderline between cervical and thoracic parts of the esophagus. And this is projection of the aorta, thoracic aorta. We can see that the heart was cutted in this picture. So aorta, thoracic aorta, it has several parts at the thoracic cavity, so named arcus aorta. Here it is, and here it is. We have drawn it. Then aorta descendens. Here it is, aorta descendens. And then aorta passes through hiatus aorta in diaphragm. Try to distinguish here that arcus aorta is located anteriorly to esophagus. So esophagus is located posteriorly to arcus aorta. And then aorta descendens is situated from the left side of esophagus. Here it is. And then in most lower part of esophagus, thoracic aorta is located behind of the esophagus. I use dotted line here, and in this picture we can't see this inferior part of the aorta. Why? Because it is behind of the esophagus. This dotted line demonstrates this position. Then let's designate them. So letter A means upper part of thoracic region. Aorta is situated anteriorly to the esophagus. In upper part of thoracic region, arcus aorta is situated anteriorly to the esophagus. And this place of cross-section, aorta and esophagus, we can mark as fourth thoracic vertebra. This place is fourth thoracic vertebra, T4. Then letter B means middle part of the thoracic region, and here aorta is located to the left of the esophagus, from the left side. And now letter C. Letter C corresponds to the lower part of thoracic region, and now aorta is behind the esophagus. This relationships means syncope. Syncope. And now I want to draw the bronchi. You know that trachea, the respiratory tract organ, it divided into two main bronchi, right bronchus and left bronchus. And they are also in close relationships with the esophagus. This place of bifurcation of trachea is one vertebra low than arcus aorta position. It means this is thoracic 5 level. Arcus aorta in thoracic 4, and the bifurcation of trachea in thoracic 5 region level. Also, we have a lot of small but very important structures which are also close to esophagus. For example, this nervus vagus. From right side, nervus vagus dexter. I use this yellow line to demonstrate that nervus vagus from right side is situated quite close to the right side of esophagus. And then, after penetrating the diaphragm, we can find vagus as dotted line posteriorly to the corpus ventriculi. This is gaster or ventriculus, and we can see that right vagus nerve is located posteriorly to the corpus ventriculi. That's why in thoracic cavity, nervus vagus in abdominal cavity become not nervus vagus dexter, but truncus vagalis posterior. Why posterior? Because it is behind of the ventriculus. And truncus vagalis posterior is the more distal projection of nervus vagus dexter. And now from left side, this is yellow line, means nervus vagus sinister. Nervus vagus sinister in abdominal cavity is situated on the anterior surface of the corpus ventriculi, and that's why it is called as truncus vagalis anterior. So we should keep in mind that in thoracic cavity there are two vagal nerves, nervus vagus dexter and nervus vagus sinister. But in abdominal cavity they are disappeared as nerves, but we use another terms, truncus vagalis posterior from the nervus vagus dexter and truncus vagalis anterior from the nervus vagus sinister. The next very interesting question is position of esophagus according to the median plane. Esophagus is quite long tubular part of alimentary canal. So that's why if we use the designation of medial plane as this red line, so one part of esophagus is from left side of the middle plane or medial plane, and another part, for example here, is located from right side relative to median plane. So in thoracic region it is both from left and right side, but in cervical region esophagus is situated only from left side. So this is those part of esophagus which could be seen, for example, in ultrasound examination of the neck here from left side of the midline. And here at the level of thoracic 6 and thoracic 7 vertebrae we can find the esophagus on the right from midline. And this is place of penetration through the diaphragm. In this place, again we can find esophagus from the left of the middle line. This is level of 10th and 11th thoracic vertebrae. The next very important question, constriction sites of the esophagus. Because esophagus is quite large in length tubular organ, it has several narrowing parts. These narrow parts called as constriction sites. Some of them are anatomical constriction sites. It means that in cadaveric specimen we can find these anatomical constriction sites in esophagus. There are 3 anatomical constriction sites. First of them is pharyngeal constriction site. Pharyngeal narrow place. It is located at the level of 6th and 7th pharyngeal vertebrae. Practically it means that from this narrowing the esophagus starts. esophagus is the next part after pharynx. So before this anatomical pharyngeal narrowing is pharynx, and after, caudally to this pharyngeal constriction site, is the cervical part of the esophagus. The first constriction site is pharyngeal constriction site. Then so named bronchial constriction site at the level of thoracic fourth and fifth vertebrae. This constriction site is designated here as bold red lines because it is result of the contact with the place of bifurcation of trachea in two main bronchi. So this contact results in formation of bronchial constriction site. And the last third constriction site is in those places where esophagus penetrates the diaphragm in hiatus esophageus diaphragmae. So when it penetrates the diaphragm, we can find the diaphragmatic constriction at the level of 10th thoracic vertebra. So, three anatomical constriction sites, three anatomical narrowing places in esophagus. So anatomical constriction sites we can find in specimen, cadaveric specimen, because they are permanent. And also there are two physiological constriction sites which exists only when the individual is alive. After death, they disappear. So there are two physiological constriction sites. First of all, aortic. It is located at the third and fourth thoracic vertebra. So one vertebra cranially, according to bronchial anatomical constriction site, and is in those places where arcus of aorta cross out the esophagus. This place corresponds to third and fourth vertebra. And the last, fifth, in a common account, cardiac physiological constriction site. It corresponds to 11th thoracic vertebra. Anatomical constriction was at the 10th thoracic vertebra, and this cardiac constriction one vertebra caudally. It designated here by the green lines, and they correspond to those part of esophagus which prolongate to the pars cardiaca of ventriculus. That's why we use this name, cardiac constriction site. So it is quite important that, for example, when the physician make the procedure of gastroscopy, fibrogastroscopy, contemporary methods, endoscopic methods, which permits to see the mucous membrane, mucous sheet of the esophagus and the gaster. So this process of entering this instrument, fibrogastroscope, inside the esophagus could be difficult in these narrowing places. So it's danger to damage it during process of entering through these narrowing places of esophagus. And I again use designation of the lips that we can compare at what length from the teeth each of these narrowing places are located. The clinicians very often use this data. So from the teeth and from the lips, practically the first 15 centimeters is to the first narrowing place, to the pharyngeal constriction site. Then next 25 centimeters corresponds to the thoracic part and abdominal part. Abdominal part is quite short, only 1.5 or 2 centimeters. And when I said to you that the length of the esophagus is about 25 centimeters, that was length from the cervical part, without those way from the teeth, because here it is the place of throat and oral cavity. But nevertheless, when physician enters fibrogastroscope to the esophagus from the oral cavity or nasal cavity in some situations, it should count the centimeters to be understanding the level of penetrating. So this is most important information according to our theme, topography of the esophagus.